ECG Interpretation. This is a brief overview of how to read your ECG rhythms. We're going to start off with our image of a normal sinus rhythm. So you should be able to identify each of the waves seen here. So let's see, this one is our P wave. And what does it represent? So remember, this image is referring to electricity, not the actual mechanics of the heart. So it's representing something that's happening, physically happening with the heart. So our P wave represents atrial depolarization. And depolarization means contraction. So if we see a P wave, that means the atria are contracting. The next one we have here is our QRS. So our QRS complex represents ventricular depolarization. So now the ventricles are contracting. So we want to see a P wave before every QRS. And that should make sense to you in your mind because our atrium contract and then our ventricles contract. Next we have our T wave right here. So our T wave represents ventricular repolarization. Okay, repolarization, which represents filling or resting. Okay, so QRS, they've just contracted, they've squeezed out all their blood. And then we go to the T wave, which represents them resting and filling. A necessary stage because we want our ventricles to have time to fill up with blood so the process can repeat. Then we have this little wave here, the little U wave. Normally we really can't see this one, but since it's on here, let's name it. So U wave represents the Purkinje repolarization. So they're getting ready too. Remember, the Purkinje fibers are the last end of that action potential that's going through the heart. Okay, so these are the parts. You should be able to identify those. This image here shows you our intervals and our segments. So we can also measure these to identify abnormalities. So for example, if we look at our QRS, so our Q, let me change my pointer here so you can see it, QRS, and we call this QRS duration. So if we measured this, because as you'll see on the next slide, this is time, okay, this axis across here is time. So if we measured this and we identified that our QRS duration is widened or narrowed, then that could represent an abnormality. It could mean like an electrolyte imbalance or maybe like a side effect of a medication. And we can catch that on the ECG monitor maybe before the patient even has any other signs and symptoms. You've heard of a myocardial infarction, like a STEMI. It's an elevated ST segment. So if you look here at our ST segment, this is this light orange and you follow it. This is here right at the end of the QRS wave to the beginning of the T wave. So you see it's flat. We're looking at a normal sinus rhythm. It should be flat. We kind of draw an imaginary line across here, and that's kind of like our baseline flat line. So in ST elevation, this is literally elevated. Like it looks like a wave. So that could indicate that the patient is having a elevated ST segment, meaning that they're having some type of injury to their heart muscle. Okay, so again, we can measure these intervals. So our PR interval, ST interval, TP interval, QT interval, and then also P wave duration, PR segment. So we can measure all of these things. One thing I want you to take note of is our RR interval. So you can see that these waves down here, you know, they're not sharp, they're soft, right? Soft waves here. So if we think about our QRS being ventricular contraction, we can have that represent our heart rate. So when we are looking at a rhythm and we want to determine the heart rate, then we could actually just count this R because they're pointy and they're easy to see normally. We can also measure the RR interval, so the R to R space in between. That's going to tell us if the rhythm is irregular or regular. because if they have an equal distance from each other, then that means they're regular. If you have an R that comes right here, like where I'm pointing, and then the next R is way over here, those are not regular, those are irregular because there's no pattern. Okay, then we'll get into that next. Okay, so just remember we can measure all of these. We are not measuring them in this class, but know that the measurements do have some significance. So then we look at ECG paper. So this is special paper. It's a grid, and we have bolded lines and we have regular lines. So this axis, the vertical axis, is amplitude. It's voltage. It's how strong the electricity is with whatever we're looking at, like the wave. So if you have a really high wave like this, there's a lot of electricity going through versus one that's a little squiggly line like this. The horizontal axis this way is time. So let's look at this. So if you're looking at one of these little itty bitty boxes right here, like this little itty bitty box right here, it's 0.04 seconds. Remember, this is a heartbeat cycle, the cardiac cycle that we're measuring. These are fractions of a second. So one little small square represents 0.4 seconds. One large box, one bolded box represents 0.20 seconds. Okay, so if we count those boxes, 5 of those large bolded boxes will equal 1 second. And if you counted all of these boxes right here, it would be 30, and that would equal 6 seconds. So the ECG paper will normally have markers on it, so it can tell you where your 6-second marker is. So if we are trying to determine the heart rate, which is how many beats per minute, and we have a 6-second strip, then we know that if we multiply it by 10, we can find out how many beats per minute. Okay, so that's where that number comes from. So if you have a 6-second strip, okay, and you can determine that by counting all these little boxes if you wanted to. 6-second strip, and say we have something that looks like that. We could count these 1, 2, 3, 4 and multiply it by 10, and we could get the beats per minute. Okay, so that's how we get heart rate. That's one way we can do the heart rate. We're going to start with number 1 off your practice sheet. So let's take a look at this rhythm. So first we're going to determine whether it is irregular or regular. And I can see just with my eyes that this is irregular. So between the R's, we're going to take a look. So this is the distance that we're looking at. These should be equal between each R in order for us to call it a regular rhythm. So you can see some are narrow, some are wide. Again, we're just looking with our eyes. If we were unable to really determine with our eyes just looking at it, we are going to count these boxes. So if it's regular, then they'll have the same number of these little boxes in between each R. Okay, we're calling this the R, right? Part of our QRS. Okay, so we're going to say that this rhythm is irregular. Now let's count the rate. So we're going to count the R's. So here's 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so we have 9 R's, and we're going to multiply it by 10 because we're going to assume all of our strips here are 6-second strips. Okay, so we're looking at 6 seconds, and we're going to multiply that by 10 to reach our 1 minute calculation. Okay, so the heart rate for this is going to be 90 beats per minute. Okay, so this is irregular, 90 beats per minute. Now let's determine what rhythm it is. Okay, so we do have a QRS complex, which means the ventricles are contracting, but there's not really a defined P wave. We just have this squiggly little line. So that is atrial fibrillation. So this little line, the atrium are not really contracting as they should. They're just kind of fibrillating, kind of quivering. Okay, so this is atrial fibrillation. Whoops, fibrillation, or AFib. Okay, number 2. So first we're going to determine whether this is a regular or irregular rhythm. And again, I can see with my eyes that it is very regular, but if we wanted to, we could count these boxes. So let's count them. 1, 2, 3, 4, and almost a fifth one. We have 1, 2, 3, 4. Again, almost a fifth one. 1, 2, 3, 4. Little, almost a fifth one. So this is regular. So this is a regular rhythm. Now, what is the heart rate? We're going to count those R's. So 1, 2, 3, 4, 5, 6. Okay, and we're again assuming this is a 6-second strip. So we're going to have 6 times 10. That's going to be 60. We know that a normal resting heart rate for an adult is 60 to 100. So this is sinus rhythm. Okay, so we have a regular rhythm, 60 beats per minute, and that is normal sinus rhythm. Okay, next, let's determine whether this rhythm, this is number 3, is regular or irregular. So I can see with my eyes that it is pretty regular, even though it doesn't look like a normal sinus rhythm. We know if we counted these boxes here, it looks to be just about the same. Okay, so we're going to say this is a regular rhythm. Now, this wave does represent a QRS. It's just really wide, and it doesn't look like how we normally would say QRS is, but this is a QRS. So this tip here is going to be our R, just like anything else. So let's find out what the rate is. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, we'll say 22. We're going to multiply that by 10 because this is a 6-second strip, and we're going to get 210 beats per minute. That is pretty high. So we know that the word tachy is going to be somewhere in there. We can't really see a P wave. I don't see a P wave here. So this means that it's a ventricular rate. So this is ventricular tachycardia with the rate of 210 beats per minute. Some would say that this looks like tombstones, that shape kind of like this. Okay, so ventricular tachycardia, regular rhythm with 210 beats per minute. Okay, so we're at number 4. So first let's see if this is a regular or irregular rhythm. So just looking at it, it looks pretty regular, but let's count the boxes. So we have 1, 2, 3. Okay, we'll count this as 1. 1, 2, 3, and some change. 1, 2, 3, and some change. 1, 2, 3, and some change. 1, 2, 3 and a quarter. 1, 2, 3. Okay, so it looks pretty regular. So we're going to call this a regular rhythm. What is the rate? So 1, 2, 3, 4, 5, 6, 7, 8. 6-second strip, it's going to be 8 times 10 is 80. So we have 80 beats per minute. What is the rhythm? So we know that the ventricles are contracting, okay, but there's also this. This is not a true P wave. This, we're only supposed to have one wave here, and it's usually round. These are not round, and they're not squiggly like the previous one. The squiggly one was like this. Remember, you can't really discern. These have kind of, you can kind of see each wave here, and these are called F waves. Okay, so this is atrial flutter. And you'll just need to memorize the different characteristics of each rhythm. But we have a QRS, and then we have these little semi-pattern-like F waves, and we don't count them. Okay, so we have a regular rhythm, about 80 beats per minute, and it's atrial flutter. Number 5. So this is a very fast rhythm, I can see that. So let's see if it is regular or irregular. It does look like they are about the same distance apart. I'm not going to count all of them, but you could also have calipers, these little things that look like this, and just kind of move it to measure it. You can get a little piece of paper and you could measure it, measure the first one and then just move the paper over. So let's see, we have I think this is regular. So we're going to say regular rhythm. What is the rate? So we're going to count the R's. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. So there are 18 R's. We're going to multiply that by 10. We're going to get 180 beats per minute. Now let's see what the rhythm is. So there is a QRS. This is actually a T wave here. And we can't see the P wave in this image, but there is a P wave there. This is SVT, or supraventricular tachycardia. Ventricular tachycardia. Okay, 180 beats per minute, regular SVT. Next we have number 6. So first we're going to check to see if it is irregular or regular. It is definitely irregular. I can't even count, the distance between the R's. So that's irregular. Okay, let's determine the rate. So if we were to count these R's, which looks like there are some R's, if you see in this area, we can't really count those. Not sure what they are. So we don't know what the rate is. Okay, so what rhythm is this? So this is kind of, it's actually missing the other boxes up here because this actually has low amplitude. So this, what I mean by that is that this is actually a very squiggly line like this. It doesn't go up big like this, and it's kind of deceiving in this strip because the strip cuts off here. But this is ventricular fibrillation, or VFib. So VFib has low amplitude. So again, it's not going to show like these high waves like this. It's kind of chaotic and irregular like that, just like it is here. So this is VFib. Okay, the next one, number 7, let's check to see if it's irregular or regular. Just looking with my eyes, I can see that it's irregular. This is kind of short, and then we have a wide one here. So this is irregular. Let's count the rate. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 times 10, we're going to have 120 beats per minute. And then if we look here, I cannot count these. If these are P waves, they're kind of squiggly like this. This is AFib, atrial fibrillation. Okay, next one, number 8. So is this irregular or regular? This looks regular to me, but we could count the boxes. 2, 3, 4, 5, 6, with some change on either side. 1, 2, 3, 4, 5, 6, with some change on either side. So this is a regular rhythm. What is the rate? We have 1, 2, 3, so that's going to be 3 times 10. That is 30 beats per minute. There is a P wave here next to the QRS, so that looks like sinus brady. Okay. Number 9, is it irregular or regular? It looks kind of regular to me, but let's count. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, whoops. 1, 2, 3, 4, 5, and then 6. Okay, so this is also a regular rhythm. What is the rate? 1, 2, 3, 4, 5. 5 times 10, we have 50 beats per minute. So we already know that's below 60. This is a brady. And we see a P wave before every QRS. So this is indeed sinus bradycardia. Number 10. Is it regular or irregular? It looks pretty regular to me, but we can count the boxes. 1, 2, it's like 1, 2, 1, 2, 1, 2. Okay, so this is going to be a regular rhythm. What is the rate? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So we're going to do 12 times 10, 120. So we have 120 beats per minute, so that's definitely tachy because it's over 100. What is the rhythm? Okay, so if we look, we have our QRS, and we also have a P wave before every QRS. So this is going to be sinus tachycardia. Next, number 11, is it regular or irregular? Okay, I can tell it already looks irregular because we have like this really wide one, and then this one doesn't look as wide. So 1, 2, 3, almost 4, 1, 2, 3, almost 4, 1, 2, 3, 4, almost 5. Okay, so this is irregular. What's the rate? 1, 2, 3, 4, 5, 6. So that's going to be 6 times 10. We have 60. Okay, so do we have a P wave before every QRS? So this kind of looks like a P wave, but it's not, because look at how many of them are there. We can't tell what's a P wave. These are F waves. They have that sawtooth look to them, you know, like this. So this is a flutter, atrial flutter. Remember, usually, most of the time, atrial flutter does have a regular rhythm, but sometimes it can be irregular. So it can be regular or irregular. Next is number 12. All right, so what is this? Can we determine whether this is regular or irregular? So we're going to look at our R's. Here's one R here. 1, 2, 3, 1, 2. There we go. We already know right away this is irregular. What is the rate? So can we count the R's? 1, 2, 3, 4, 5, 6, 7, 8, maybe 9. So 90 times 10, we have 90 beats per minute. And what is the rhythm? So we do have a QRS, and is there a P wave? Definitely no P wave. There's just some squiggly lines. They don't really look like a pattern like the one we just saw with the sawtooth one. So this is atrial fibrillation. Okay, so these are just like squiggly, you can't really tell, can't count them. Irregular rhythm, 90 beats per minute, atrial fib.